Assalamualaikum dan salam sejahtera. Kini tibalah masa untuk semua peserta bersedia untuk sesi pendaftaran dan persediaan kerana E-Colloquium akan bermula sebentar sahaja lagi. Bismillahirrahmanirrahim. Pohon selasih tumbuh sebatang, sayang merbah di dahan cemara. Terima kasih dan selamat datang. Kalimah bismillah pembuka bicara. Assalamualaikum, salam sejahtera dan salam menjulang pendidikan Sarawak. Yang berusaha Pengarah Jabatan Pendidikan Negeri Sarawak, Dr. Norisah binti Suhaili. Yang berusaha Puan Mariam binti Haji Monek, Pegawai Pendidikan Daerah Miri. Yang dihormati Encik Awang Ali bin Awang Ahmad, Pemangku Timbalan Pegawai Pendidikan Daerah Sektor Perancangan. Yang dihormati Encik Wong Kung Kui, Timbalan Pegawai Pendidikan Daerah Sektor Pembelajaran. Yang dihormati Cik Artini binti Anwar, Timbalan Pegawai Pendidikan Daerah Sektor Pengurusan Sekolah. Yang dihormati Puan Ten Fen Ni, Pemangku Timbalan Pegawai Pendidikan Daerah Sektor Pembangunan Murid. Yang dihormati Encik Jumari bin Hashim, Yang di-Pertua Persatuan Pengetua Sekolah Menengah Daerah Miri. Yang dihormati Encik Ahmad bin Osman, Pengerusi Majlis Guru Besar Daerah Miri. Barisan Pengetua, Barisan Guru Besar, semua pegawai ikhtisas, Pejabat Pendidikan Daerah Miri, para peserta E-Colloquium, tuan-tuan dan puan-puan yang dihormati sekalian. Bagi menambah keberkatan majlis kita pada hari ini, dipersilakan Al-Fadhil Ustaz Haji Awangku Zulkarnain bin Haji Awang Ayub untuk memimpin bacaan doa. Dipersilakan.
Bismillahirrahmanirrahim. Alhamdulillahi Rabbil Alamin. Assalatu wassalamu ala ashrafil anbiya wal mursalin wa ala alihi wa ashabi ajma'in. Ya Allah, ya Tuhan kami merafakkan rasa kesyukuran kepadamu yang telah mengizinkan kami untuk berada dan menghadiri E-Colloquium peringkat antarabangsa Pejabat Pendidikan Daerah Miri 2022. Ya Allah, ya Qahar, ya Jabbar, sesungguhnya pada hari ini dan minggu ini kami berkumpul bagi menghubungkan silaturahim, bertukar-tukar pendapat, di samping menyumbang buah fikiran dalam membentuk generasi yang berguna pada masa hadapan. Berkatilah usaha kami ini, ya Allah. Ya Rahman, ya Rahim, ya Rabbal Alamin. Engkau perbaikilah akhlak kami. Engkau hiasilah kami dengan akhlak-akhlak yang baik dan terpuji. Juga hindarilah kami dari sifat-sifat keji. Hindarilah kami dari sifat yang lalai, merugikan dan membimbinglah kami ke jalan kebenaran. Ya Hayyum, ya Qayyum, ya Zal Jalali wal Ikram. Malah kami memohon daripadamu, ya Allah, dengan penuh ketaakulan agar majlis E-Colloquium peringkat antarabangsa PPD Miri 2022 ini akan menjadi katalis dan sumber inspirasi ini kepada para pendidik lain, supaya mereka sama-sama mengerah keringat dan menggulung tenaga untuk mencapai kecemerlangan demi mengharumkan Jabatan Pendidikan Negeri Sarawak amnya dan Pejabat Pendidikan Daerah Miri khasnya. Berkatilah usaha-usaha kami. Mudah-mudahan dengan usaha-usaha kami, Jabatan Pendidikan Negeri Sarawak serta Pejabat Pendidikan Daerah Miri ini akan memacu amanah pendidikan yang cemerlang, terbilang, yang disegani dan dihormati sama ada dalam bidang akademik maupun kepribadian. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina azabannar. wa sallallahu alaihi sayyidina Muhammad wa ala alihi wa sahbihi wasallam. Walhamdulillahi rabbil alamin.
Terima kasih kepada Al-Fadhil Ustaz atas bacaan doa itu tadi. Selamat datang ke E-Colloquium Pendidikan Peringkat Antarabangsa Pejabat Pendidikan Daerah Miri tahun 2022. Syukur Alhamdulillah, segala puji dan rasa penuh kesyukuran kepada Allah Subhanahu wa Ta'ala kerana dengan limpah kurnianya E-Colloquium Pendidikan Peringkat Antarabangsa Pejabat Pendidikan Daerah Miri tahun 2022 dapat direalisasikan dengan jayanya. Saya, Sharifah Masni binti Wan Muhammad, akan meneraju acara E-Colloquium Pendidikan Antarabangsa Pejabat Pendidikan Daerah Miri tahun 2022. Majlis merakamkan setinggi penghargaan dan ucapan terima kasih kepada sidang hadirin yang hadir bersiaran bersama secara langsung pada hari ini menerusi laman Facebook dan channel rasmi YouTube PPD Miri. E-Colloquium Pendidikan Antarabangsa Pejabat Pendidikan Daerah Miri ini akan berlangsung selama 3 hari bermula 22 Februari hingga 24 Februari 2022. Hadirin sekalian, Colloquium Pendidikan adalah usaha kolaboratif secara profesional yang dirancang dalam kalangan warga pendidik dalam melakukan aktiviti penambahbaikan khususnya proses pengajaran dan pembelajaran serta prestasi sekolah. Colloquium pendidikan dalam kalangan pendidik dilihat sebagai usaha yang dapat meningkatkan profesionalisme dalam kalangan warga pendidik. Konsep colloquium adalah untuk menyediakan suatu platform bagi mewujudkan kolaborasi antara sekolah menengah dan sekolah rendah, khususnya warga Malaysia, untuk berkongsi tentang amalan terbaik khususnya berkaitan dengan pengajaran dan pembelajaran antara semua pihak yang berkepentingan dengan pihak sekolah untuk memantapkan penyampaian pendidikan, seterusnya meningkatkan pencapaian murid. Seterusnya, selayang pandang dari meja pegawai pendidikan daerah Miri, majlis mempersilakan Puan Mariam binti Haji Monek, pegawai pendidikan daerah Miri, untuk menyampaikan ucapan alu-aluan. Dipersilakan.
Assalamualaikum warahmatullahi wabarakatuh. Good morning, ladies and gentlemen. Thank you for being here with us today. We are pleased to be able to welcome everyone to our special event today. First, let us all express our gratitude to Allah Subhanahu wa Ta'ala because with His permission, we can gather in this international education E-Colloquium. Hopefully, this E-Colloquium, which begins on 22nd until 24th of February, will run smoothly. It is my greatest hope that this E-Colloquium will give a meaningful impact and experience for all the participants. The theme of the 2022 International Education E-Colloquium this year is Innovate to Inspire, which is to innovate in order to inspire teachers to continue to strive in producing student need in line with the development of the new millennium. The E-Colloquium is also in line with the Malaysia Education Development Plan Wave 3, which focuses on fostering a culture of professional excellence in the standard of colleagues through a culture of professionalism guided by colleagues, for example, teachers and school leaders who guide each other, share best practices, and ensuring that fellow colleagues have the responsibility to meet professional standards. Action research produced by educators is one of the evidence of an excellent culture in teacher professionalism that should be highlighted and shared through colloquiums. I would also like to list some of the objectives of the E-Colloquium, which are to increase the culture of reflection and collaborative practices among educators, to strengthen the impact of teaching and learning with the implementation of creative and innovative interventions, and last but not least, to encourage the sharing of best practices among fellow educators. Ladies and gentlemen, we are very grateful to have successfully invited 9 experts from within the country and abroad, especially in the areas of early childhood education and special education. The E-Colloquium is held entirely online and will be broadcast via YouTube according to the presentation schedule, which is made available in the E-Colloquium portal. About 122 action research will be broadcast in 4 different parallel rooms, which are international, STEAM, language, and others. Therefore, I would like to call all educators and community, whether locally or abroad, to join this E-Colloquium. Thank you very much.
Majlis mengucapkan terima kasih kepada Yang Berusaha Puan Mariam binti Haji Monek atas ucapan itu tadi. Para hadirin, kini tibalah masa untuk ucap tama pertama. Untuk itu, majlis dengan segala hormatnya mempersilakan Dr. Teck Hock, Special Children in Malaysia, Achievement and Challenges. Dengan segala hormatnya, mempersilakan
Hello, hi, good morning, everyone. Today, we are going to have a slot by Dr. Teck Hock, a very prominent personnel in the field of special needs children. So let me introduce Dr. To first. With the topic Innovate to Inspire Special Needs Children, the Achievements and Challenges. So Dr. To is actually a doctor in Cebu. He is very active in the special needs for the special needs children. And just a brief introduction about Dr. To. He got his bachelor's degree. He is a member of the Royal College Pediatric, Royal Australian College of Physicians, also Academy of Medicine Malaysia, National University of Singapore, and also Royal College of Pediatric. So just to cut time short, we'll invite Dr. To. I'm very sure that he has a lot to talk about. So welcome, Dr. To. So we are live right now. Thank you for agreeing to join this colloquium. So how are you, Doctor?
How are you, Jagu? Thank you very much for inviting me.
Okay, so you are very active for the special needs children. So as I got to know that you've been very active since you came back from overseas, that is in about 2004, am I correct?
Correct. Yeah,
okay,
that's what I do as a doctor.
Yeah, okay, very good. So, and also you're very active with the Special Olympics children. You train them swimming?
Oh, no. Actually, I'm not very good at swimming. All right, my children are, but in Special Olympics, this is an international sports organization for people with intellectual disability. So I'm actually the Asia Pacific Regional Clinical Director. So I kind of like look after the health aspect. But the coach is the one who do the training for swimming and athletes and bowl.
Mm-hmm. Okay, thank you so much, Doctor. So I will leave the floor to you, Doctor. So this is your presentation. So thank you so much again for agreeing to join us. And I hope everybody would benefit from your presentation. Thank you again.
Thank you. Thank you, Jagu. So yeah, this is slides. Can I make a start now? Okay, right. I guess this is time. Well, I understand that this is actually a recorded sessions and to be shown on this E-Colloquium. Well, first of all, I would like to actually thank the organizer for inviting me and also giving me this chance to speak to all of you. And I hope that this is something that we can share. Now, like what Chegu was saying, that I hope that I know at the end of these topics, as I was contacted by the education department in Miri, I was hope that I can do something about to inspire some more people to join me and also my colleagues in terms of working with children with special needs as well as the families. And I will take a little bit of time to elaborate who are actually we are talking about these special needs children. And also the topic given to me is talk about the achievements and also the challenges, which I will try to illustrate a little bit. And more importantly, I think it is actually to how to move forward in this field. Now, just a little bit about myself. Who am I actually? This is my son, and I'm a doctor actually, as being said, actually especially doctors who look after children. But over the years, I've actually been involved in the special needs children as well as young adults and with intellectual disabilities and special needs. So I do my work. I'm actually specialized in developmental and behavioral pediatrics as well as community child health, where I actually have some special interest in working with them. So in children development and behavior, quite often the time, we play with them. But I'm also a father of 3 children, and in my eye, in the eyes of my child, this is how I look like it. So as a father of 3 children, I often tell people that how much I wish that all my children are all the same. Just like taking these photos. You ask, okay, everyone show your victory sign, and then tap, and someone is just going to show something funny. So this is exactly what the children are. They are never the same. And I got 3 children, and they're all very different. Even though they come from the same mother and the same father. And number 2 thing that I like to declare is I'm just a doctor. And quite often the time, I must say that quite sometimes some parent will come and tell me and say, oh, this Cikgu said that, this Dr. Toso Pandai, ask him to go and teach. I'm sorry, I tell the parents that I don't know how to teach, because otherwise I wouldn't have sent my children to school, and hoping that the teachers can teach my children and educate them well. So as a doctor, I do have some experience with my own children. And I just want to share a little bit about my 3 children before I actually start talking something a little bit serious. So my first child, Aaron, when he was young, he was quite interested. He's quite a talkative guy. And so I was trying to coach him how to do a public speech. He was asked by school to present, in a primary school to take part in these competitions. So, I spent quite a lot of time and talking to him, but he never listened. And then one day he came home and said, Daddy, Cikgu Go says that I have to look up, I have to actually pay attention on my intonation, volume, pauses, and hand gesture. I said, yeah, I just talked to you about this last night. But I said, no, you didn't. And also, he was listening to Cikgu. So you can see that the teachers is actually play quite a lot, have played a very important part of in the children's life. And the story go on, and unfortunately, this child, when he was getting to about primary 5, primary 6, my wife and myself are getting quite a lot of phone call from the group side every day. Because why? Because he didn't want to do his homework. In fact, he was very capable. In the classroom, he would disturb the others by, try to teach the others how to do their homework. Instead, he himself didn't want to do his homework. So, and I think that gave the school a bit of stress, I believe. And because he was so special that the Guru Besar called out and said, hey, unfortunately, because that school is actually trying to stream the children, the so-called good one in one class, the not so good one in another class, and the poor one in another class. Something that I never agree on. But anyway, as I said, I had to send my child to school to get educated. So because of the trouble that my child created, I had to agree to my child not going into this so-called excellent class. And at the end of the day, and UPS outcome, and quite fortunate enough, my boy got something quite good. In fact, a number of years later, he during a casual talk, Daddy, when I was in UPSR, you all put me into this not so good class, but doesn't matter. I proved to the school that I could do better than those, friends of mine. because he was asked to move class, so he lost quite a lot of his friends. So this is something that actually stayed in his heart for some time. And my youngest one is another boy. Is quite, I must say, is quite independent, quite smart. But he's the one that I actually have the most worry, because why? He doesn't like to communicate. If I were to be, not because I'm a doctor who actually have some interest in this development and behavior, I will probably bring him to see a doctor and say, hey, help me out. This child doesn't seem to like to communicate, and so he's quite kind of like a rigid and on his own. And what about the girl in between? And she has been again and again, been told that, oh no, girl, you're not as smart as your brothers, your two brothers. And one day, this girl came to me just recently. She said, Daddy, I'm actually the most generous in the family. Why? Oh, because when I was in the mummy's tummy, all the good nutrition already absorbed by Aaron, who is the eldest brother. But I kept a lot of nutrition for the younger brother to come. That's why I didn't get enough nutrition. That's why I was not as, I have not been as smart as the two brothers. Well, that, as a father, I must say, it really hurts me. All right. But the point is, well, this girl is not bad, although despite being told again and again that she's not as good, and this is just a result that she recently got. She's now doing a diploma in early childhood, and she's got on the dean list twice in the last 2 years. I don't know how do you reckon this GPA of the 3.7? I thought this is pretty good. Well, I just want to share with you another child that I recently saw just on Friday, just 3 days ago, right? So this boy actually presented to us for not talking, 8.5 years old, not talking, not doing well in the classroom, cannot sit still, create a lot of problem, and all the academic stuff cannot do. And my doctor actually did some basic assessment, basically showing that this child, in terms of his IQ, his mental age, it's like 4 to 6 years old. Now, by 4 to 6 years old, I said, okay, this child does look like a intellectual disability. This is a child that with poor intellectual functioning. But let me show you a video here. This is what he did. If I can get it right. Okay, there you go. So the parent come from the rural town. So the parent told me that this boy has been using this Google map, using a virtual road map to actually guide the parent which road to take to Cebu and to Agape Center, to where my clinic is. Look at his hand functions. And this child has never been to Kanawi. No, he has never been. He's not from Kanawi, he's never been to Kanawi. But he was somehow pointing out to the parent, showing the parent that he wants to go to Kanawi and show the way. Okay. And the teacher report saying that this is child kurang penlibatan dalam kelas, right? Bergantung kepada jenis aktiviti and has a masalah focus. And this child actually doesn't know, he's not even toilet trained properly. But this child, the cikgu also recognized that he's actually very good at reading ayat-ayat, even including in the Al-Quran and the tulisan Jawi. So this child actually could read English bahasa Jawi, and he could read it, but the parents said that he could not understand what he's reading. And he can even lafazkan, Asma Husna. And let me show you, this is what he could. So this is what a few weeks ago, he wrote down in a book. And the mother had to go and check with her agama cikgu to really confirm that this is actually coming out from the Al-Quran. So he can actually memorize and then write down. Okay. And this is another thing that he did recently. So he asked the mother to help him to draw a circle. He cannot even do a circle. So the mother had to draw the circle, and then where he write all this Jawi down. Again, this just shows that how good. So this is actually remembering me that this is a child that is very famous actually online. And if the people who can actually Google this Monek post page, whereby this young man in Kuala Lumpur, he could actually do a lot of fantastic drawing. Like, for example, this person, this Ivanstein, he's not really drawing. He's actually, if you actually pay attention to it, if you can zoom out, right? And if you go to this Monek post, you can actually zoom out the pictures. You will actually see that the pictures is actually made out of millions of ants. So this young man has autism. So as the other boy that I showed you just now, he has autism. So this is the boy that if you actually do assessment, you may think, oh, he has a mashallah intellect, but the trouble is he has such excellent skills that a lot of us don't have. So how can I call him an intellectual disability? He's just a boy with autism who has difficulty in communication, but he has such a wonderful skills. Okay, so this is another girl with Down syndrome that I saw quite a number of years ago. She has actually went through a very well trained in the early intervention program. So he was actually doing very well. But the trouble is because she has Down syndrome, the policy said that she cannot enter mainstream. So we were ding dong for about a few months until one guru was very nice and said, doctor, let's take her in. Don't worry about the policy. Just be quiet. And then she went into this class in May. And then within 2-3 weeks, she has to sit for the exam together with her her classmate. And guess what? The exam came out and she was ranked something like about 23. I cannot remember exactly now, but she was not the last. She actually ranked about 23 in the class. But the policy is still, she has to go to special class, the PPKI. So I was asking the education department, what about those people who rank it behind her? Does it mean that all the 17 of them, sorry, about what, 12 of them had to follow her to go to PPKI? So I get this illustration to show us that, it is sometimes very difficult to tell who is normal and who is special. So, in fact, all men are created equal, but not all children are born with equal condition, unfortunately. So some children, they do have some special conditions. And we do know that even among the special needs children, some children do have strengths, and some, of course, have quite a lot of weaknesses. So it is something that's very important to recognize that every children have strengths and weaknesses, but they all have equal rights to education, to play, to learn. Okay, so we now in Malaysia, we do have a lot of laws and policies to actually try to protect them so that we ensure that these children get to educate properly, get to good health care, get to play. So we do want to actually promote inclusiveness for these children in the community, including the school. And but unfortunately, we do have quite a lot of things to be done. So why children are not learning as expected? Quite often it's because of their intellectual disability. So they may be born, their genetics, their brain function may not be as good, so they may have intellectual disability. So they may have been born with a syndrome like Down syndrome. So there may be some underlying medical causes that actually making them not able to learn well. And of course, cannot see, cannot hear, and sometimes they do have these specific learning disabilities. What do we mean by that? That means that their IQ are normal, but they have problem reading, they have problem learning in a class, including the mathematics and writing. So this is the pictures that I quite often show to people. So not all children can read like you and me. So how many of you can read this passage? I can read it, can you? So if you can read this, you have a strange mind too. Can you read this? Now, quite often the time we take it for granted. But children with specific learning disabilities, specifically dyslexia, they have problem reading, right? So they have difficulty reading, but yet the IQ is normal. What about the rest? Some of them may have some behavioral emotional problems, such as ADHD, autism, like the one that I've shown. And some of them may have anxiety and depression, so that will actually hinder them from learning. We do have some other psychosocial factors, unfortunately, the family playing a part. This family discord, suppression, divorce, child abuse, domestic abuse, parents who abuse drugs, and bullies in school. These are all the things that can actually affect a child learning and making them having difficulty in learning. And sometimes they are not learning in class because maybe they are too bright. I must say that one of my child was probably too bright. And we nowadays we also have tuitions, and the parents send the children to school. Sending to tuitions. Everything learned in tuition. So by the time they come back to school, they're not learning because they already know. So these are the things that actually sometimes can hinder them from learning. And some children just need more time and basic explanation. So nothing wrong. You ask the child to expand on this formula, they'll just expand. So what is wrong with that? So this child needs some explanation. Find an X. Well, this is I think a lot of math teacher is going to go crazy if the child answers that. But to me, there's nothing wrong with that. It just means that the child needs better explanation because they have some thought process. And certainly some children are not as capable as teachers. And if the teachers cannot teach multiple subjects, then how we can expect a child to learn multiple subjects? So not all children are really geared towards multiple subjects. Some can just learn 1 or 2 subjects, and that should be realistic for us. So that actually brings us to this special needs children. It is actually a very heterogeneous population. It is not yes or no. Quite often we say, do you have autism? Do you have or do you don't have? Do you have ADHD? Yes or no? Now, actually, sometimes can be quite difficult. If you ask me, does my 3 children have any of the? I would say probably some, 3 of them will probably have a touch of autism, a touch of ADHD, a touch of some learning difficulties. So everyone have that. Even some people say that, oh yeah, I might also have autism, or I might have ADHD. So actually, it is actually not as straightforward. But children with a special need is actually a big number. We do know that every school will have at least 15% of children who have some form of disability or some form of learning difficulties or some form of special needs. So if you're actually assuming that one family has average of about 3 children in Malaysia, so a simple probability test will probably tell us that 1 in every 2 to 7 families will have at least a child with a special needs. So the number is actually big. This is not a small number. So quite often the time we say, is this child ready for school? All right. Sorry, let me move this. I seem to have a problem moving this. Okay, here you go. So I would rather ask, is the community ready for this child? Are the services ready for this child? So we do know that to actually make a child ready for school, we need a ready families, we need a ready communities, we need a ready services, we need a ready school. Because if these are not ready, we cannot make a child ready for school. And this is a cartoon that I really like so much because it says here, it reads, how do you know I have a learning disability? Maybe you have a teaching disability. Quite often, we do have hear from parents and the teacher said that I cannot teach a child. I don't know how to teach a child because the child has so much problem. So I would rather, it's just like me, a doctor. I believe that, if I were to tell a patient that I don't know how to teach, how to treat you, yes, maybe true, but I can always, I know as a doctor, I may not be able to cure every time, but as a doctor, I always have a duty, okay, to provide some comfort, to remove some stress, to remove some anxiety. That is also a part of the treatment. So I do believe that a child is always teachable. So let's say, what about if we don't teach, if a child don't learn, what is the consequences? We will actually turn an impairment, like for example, in dyslexia, a reading difficulty into handicap. All right, so the child may become more hyperactive, attention span become even more short, and then end up as being labeled as a naughty, and then some of them that will become more rebellious, may become more aggressive, and some may actually be internalizing the symptoms, become very low in self-esteem, depression, then more and more problems may occur. And some of them may starting to avoid study, refuse schooling, truancy, dropping out of school, taking out smoking, alcohol, drug abuse. Then it becomes dependent on the society and family. Then really make the child become a handicap. So always we want to do something to prevent this child from getting worse. So having said that, have we achieved, have Malaysia achieved anything? Well, so far we do know that there are many interventions that works for children, especially children for disabilities, especially for young children. I won't go through all these. So there are many programs that are proven to be effective. So for young children, we know that preschool education is very important. I must say, I myself is a very lucky one. In the 1970s, now you know how old I am. I already went to a preschool, a kindergarten. So our community already recognized preschool is very important. So does children with disabilities. It is very important for them to get the preschool education. What does the law say about children attending school? And according to the Convention on Rights of the Children, all children with disability have the right that education be directed to the development of the child's personality, talents, mental and physical abilities to her or his fullest potential. So in Malaysia, we do have Education Act 1996, ensuring all children between 7 to 12 years old to attend school. And we now also have the Child Act 2001 to ensuring that the children are not are being given protected rights to educations, to healthcare. And in 2019, we have a zero reject policy from the Ministry of Education, whereby no children can be rejected from school. All right, so that zero reject policy. No children should be rejected from school for whatever reasons. So in Malaysia, again, we are quite lucky because 7 to 12 years old, as well as 5 years in secondary school, are provided free. So this is actually one of the good things in Malaysia, that education are free. So no children should be not attending school. And now we also know that over the years, I have been back to work in Malaysia from 2004. So for the last nearly 20 years, we have seen number of schools and also the number of children who are in the program inclusive, sorry about the spelling, program Pendidikan Khas Integrasi, and we're seeing more quality teachers, scholar house. So the number has increased, but that's not enough because we need actually more inclusive education. So inclusive education, we will start from young, which is actually the kindergarten. So this is actually one of the kindergarten that has actually started inclusive education more than 10 years, Fuyan Kindergarten, and it has subsequently been enjoyed by many other kindergartens, and we do have now many more kindergartens outside of Cebu actually joining this inclusive education, whereby these are the special needs children attending the mainstream kindergarten, mainstream preschools alongside with their peers. So much so that in 2019, we actually managed to attract nearly 1,000 people to actually attend this preschool conference for inclusive early childhood education. So throughout Sarawak, we actually have many preschools who actually agree with us that children with special needs need to attend preschool in the inclusive environment. And together with Sarawak government, we have actually put together some more syllabus, curriculum, trying to actually involve more preschool like Salede, Kemas to actually take in special needs children, so that we don't really need a pra-scholar house, which is very limited in the first place. So if every preschool in Sarawak taken out, so we can actually have children even in the most rural place to actually have their early childhood educations in place. And over the years, obviously, we also have seen the budget being increased to be spent for children and also adults with special needs. We have seen successful stories over the years, and we do have more specialists, from the healthcare setting. We do have more specialists over the years. So all these are good achievements. We do have a variety of specialist therapists who are actually helping out special needs children. And we do see the number of children being increasing. Not that because we have more children, it just means that more children are being seen and getting help over the years. So, and what is actually more important is actually, for example, in my clinic, we have a number of children with autism being seen has been increasing. But even more important is actually the age. We are now seeing younger children. We are seeing younger children with actually autism. In the past, it has been nearly 4 years old before they start presenting, but now we're actually seeing children as young as 3 years old, and this is until 2015. For the last 5 years, we've been seeing children about 2+ years old. And there are more schools actually being involved, and we're involving medical schools actually in getting into training our doctors to actually know about special needs population. We also have, for example, like teaching institutes who are actually training our preschool teachers about special needs children. We are seeing more also of this community taking out involving in special needs children. But despite doing that, despite what we have done, that the challenges have always been there. And with the inverse care law, we know that actually the one who need the most the care are often the one that who are actually not getting it. So we do know that disadvantaged children from the rural, from the urban poor, the stateless children, refugees, those in plantation, those with severe disability are often neglected and often not getting what I have just shared in terms of achievement. and they are not getting that. So, and disability registration, and we know that all these achievements are not really equal, and in certain states, the numbers of disability registration are very high by percentage, but some are quite low. So it is actually not really distributed equally throughout the country, and the program and services available are actually differ quite greatly. I won't go through in the great details of this figure. This is actually available statistics. You can actually have a look yourself at your own time. Now, COVID has affected us for the last 2 years. That actually has given us a lot more headache because a lot of special needs children are actually being affected a lot, and we have seen children being early childhood education and children in the education setting are being compromised. So they're not really getting enough education, needless to say, about the children with disabilities. So really, we are not really ready in terms of this pandemic because children are quite often neglected and they're actually suffering more. And only recently, the children are starting to go back to school physical. So we have a lot more to tackle, and especially those with disabilities. I just want to have a quick show about this slide. This is actually a pictures of this young little boy. Look at him in a restaurant whereby the parents and the family are also busy on the screens. It is actually a big challenge for these screen activities affecting our children in general, especially children with disabilities as well. So now, having said all these challenges, I think it is good to know what we have achieved, what we have challenged, but I think I want to move forward. I think we know that we have many children with disabilities. We do know that early detection is important. We know that early intervention works, but we do know that we have quite limited resources everywhere. Despite we have more specialists, more healthcare, more therapists, more special education teachers now, but it is on the whole still limited. And the way forward is really to continue putting our effort on early detection, so that we want to do a formal screening, create awareness, early detection, so that we can train them early before they go to school. And we do need to work with our NGO, with our PDK, our therapists, to work with our early childhood education centers such as kindergarten, preschool, so that children can be included, can be trained early before they turn into a primary school age to go to school. We do want to move into an ECE, inclusion and inclusive education. So we do need to start our way forward. And you, right, are the one that is in the driving seat. We are the one who driving this. So it is we are driving the system. Don't let the system drive us. Well, if not forward, at least we don't go backward. Right? For example, we know that segregation, meaning that to segregate children, all right, into one class, that you are not normal, you are special, you go to one class, and you are normal, you come to this class. That is segregation. We know that this is not good because it is expensive, it promotes dependency, it demoralizes people, it creates more people who need more help. And also don't cut funding on screening and early intervention. This is really what we need to put the emphasis to train the children early so that they are ready to go to school. Don't jeopardize some of the good centers, some of the PDK, some of the NGO are doing good work. We need to support them. And don't kill the kindergarten or school. In fact, we have many schools who are doing wonderful work. We need creativity, we need innovations, so that this school can be, because they are the ones who know at the local setting what the child needs. So we need to support them. And don't waste money on things that don't work. We do know many of them. So education settings, this is what we generally have. So we do have children who are in the that we pick up. We do need to train them early in, let's say, for example, in the PDK. By the time they're in prasekolah, they should go to prasekolah biasa. All right. We don't really need too many of these prasekolah house. That should really be reserved for those who are maybe should be reserved for those who are very, very, very severe. Okay. But even the very severe one, with the good support, with the right parents, with the right teacher, that can also be included in the prasekolah. Now, we may need some children in the PPKI, but generally, most of them should be included in the class biasa, which is the class perdana. And we do have some sekolah pendidikan khas, especially for hearing and vision. But again, how many of them? Because, like, for example, in Sarawak setting, we only have one in Kuching, one in Sibu, and one in Miri. But what about children in Kapit? What about children in Limban? So instead of moving these children out to this either Kuching or Miri or Cebu, that should be included in their mainstream and be guided, be trained early and guided properly so that these children don't have to leave the family. Well, what other options? So we do have options of private school and homeschooling for some parents. I won't go into the details of it, but quite often this is the parents who are desperate, who are frustrated. So, and then this is the system who fell there, unfortunately. So we do have these kind of parents. And on the whole, we should have at least 20% of children be supported. Why do I say 20%? As I said, about 10 plus 50% or 15% of the children with special needs, we do know that, and some of them are mild. So these children should be supported by the best teacher and by the therapist in the school environment. That's where the children learn. Otherwise, we're going to risk them becoming the biggest burden to the society when they leave school if we don't support them when they're still in school. Let's remind everyone again, what is education? Education is actually an original Greek word. It means that to bring out the treasure within. And in Chinese, in ancient China, we also have something similar concept where you teach according to what the child's strength is. So that is education. So what have I learned over the years? Jegu are very nice to introduce me. I have actually been around for some years, but what over the years I have learned together, and this is my A to F that I'd like to share with everyone here. I think we need to continue to advocate. We need to continue to advocate for our children, especially for those with disabilities, for detections, for more services, for a better quality. We want the best teachers to handle our most difficult children. We want to engage. We want to be engaged with the children, with the families. We want to engage. So really thankful that I'm given this opportunity to engage with all the education professionals here. And we want to be creative. We want to create awareness. We want to have creative activities. We do want to put the trust on our teachers who know the children best. And remember what I said, the children have a lot of respect for teachers. And the development of the children cannot wait. Quite often people will say, oh, it's okay, it's not life and death, development can wait. I'm sorry, in the last 2 years, because of the COVID, because of the MCO, many children's development has been jeopardized. And many children every year, a loss of their education, a loss of the intervention is going to lead on to a disastrous outcome for the years to come. We need to evolve. We don't want to stay static. We don't want to go backward. We do want to move forward. And to do all this, we really need to find a friend. So that's why I'm actually here trying to make friends, and together we can actually move forward. And sometimes we just have to do it. We just cannot think too much and just do it. So why do we need inclusion? A very quick word. We know that to actually enhance the EIP and early brain development, and we know that it actually benefits all children with or without disabilities, and it actually support and it actually benefit all communities. It does save costs. Okay, so I will just have to skip these pictures in view of the time. But really, what we want is actually to create an equity. But a lot of time, then in reality, is those, as I say, the inverse care law. Those who are resourceful are getting all the resources. What we really need is actually to break down the barriers so that children can learn, right? Regardless of their abilities they have, they can learn actually in the barrier-free environment. Okay, so every children can learn, even though they're with very severe disabilities, they can actually learn the basic needs to look after themselves. And there are many ways to actually accommodate and remediate, which I don't wish to talk too much because I'm actually talking to a bunch of all the teachers who are very experienced. So there are many strategies in terms of accommodation, remediation that we can actually help the children. We can actually, there are many other ways that we can actually help the children by rewarding, encouraging, instead of a punishment. We want to actually look for strength. We want to recover children's confidence. We do want to actually make the school a happy learning place for everyone. We want to build the strength of the child. It's not just about academics, but sports, arts, music, communication skills, mental health. There are many things that we can actually teach a child. So this is actually quite a good slide to actually show that early intervention works. And with a good components of the effective early intervention is really want to start as early as you can, and it must be intensive. We need to involve the parent. It is all about training the children early in terms of social and communication so that they are ready to go to school. And bear in mind that the longer a child with autism goes without help, the further it is, and that will actually apply generally to children with disabilities and children with special needs. So we want early interventions, all right, that often a time actually happens in NGO and PDK in health clinics, but the whole thing is actually to prepare them ready to go to school. And we do want to actually to have early childhood centers that are inclusive, and subsequently to primary and secondary schools, and later on to vocational training and job placement. So it's actually a long way. It is not just talking about you being normal or not normal. And in Cebu, we're actually been largely to actually have a new centers next to Agape Center, actually to provide sheltered workplace for adult and independent living home. So I'm coming to my conclusions, and a child may have learning disabilities, but that quite often because they have actually underlying learning problem. And we do want to make sure that adult, right, health and educational professional ourselves don't have training and teaching disabilities. We need to be able to learn to actually help these children to learn. And we do want to actually get undergraduate training, be it to train as a teacher or train as a health professionals. We do want to actually continue this lifelong learning to continue to upgrade ourselves so that we can actually support these children. And we do want to focus on early interventions. We do want to work with this PDK, and we do want to actually use evidence-based practices. We want to collaborate together to prepare our children to go to school. And we want to recruit the brightest students to be the teachers, to be the interventionists. I think that's very important because we really need a good teacher, because being a teachers is not easy. To teach especially children is not easy. So hence it makes sense that we need to actually to have the best students to become a teacher to actually support our children. Another thing is actually for teachers and therapists that very important, because it's just like in doctors. A junior doctor coming into the field, he will be guided by a medical officer, and then the medical officer will be guided by a specialist. And I think in the teaching faculties, we should have the same. Therapists, we should have the senior therapy, the senior teachers need to guide the junior teachers and guide the junior therapists so that they can build out their confidence rather than first day entering the classroom and here you go, this is yours. Okay, so I hope that you are convinced what I've been trying to share. And I hope that you're not being confused by me. But with this, I actually come to a conclusion that when the children are not learning, they do means that these children have some underlying learning difficulties. And with the learning disabilities, it's actually quite often associated with some other comorbids. And we do need to support them for the academic achievement with using many methods, remediations, combination, and some phonological training. We do need to advocate for these children, and to fully utilize our very local limited resources to actually make our children healthy and subsequently become healthy adolescents, healthy adults, and a healthy society. We know that the number is big, and we know the early intervention is very important, and we do need a team, including the parents, and we do need to practice evidence-based intervention. We want to make real inclusion real. All right, so early detections, accessible early intervention program, and we need everyone to actually contribute and support that goes on. And many things that we can do to help children, as I have said, from parenting to build resilience, to actually have an early and learning environment. And because we do all this, because we know that to invest our children's health, to invest in our children's education, that is actually the best return for our society and best return for our country. So last but not least, I just want to actually gently remind people that we still have this National Early Childhood Intervention Conference that are supposed to schedule in 2020, but because of COVID, we have postponed it, and now it is actually in September 2022. So please write to us if you're interested to attend. It will be in Imperial Hotel in Miri. So for that, I thank you very much, and I must say that thank you to my 3 children and my lovely wife. Because of them, that's why I'm here, to be able to stand in front of you to share. Thank you very much.
Thank you very much, Doctor. So that was a very interesting talk, the one you've given, and is really inspiring. So I just want to ask, Doctor, you said that all men are created equal, not all children are born with equal conditions. I like that phrase because not every children they're born with equal condition. So
Exactly.
Doctor,
But there
yeah,
are,
so
even that they should have the equal rights to the education, equal right to
very,
healthcare,
very, very true
and
because
by
every
breaking
single
down
one
the
of them.
barrier.
Yeah, so because every single one of them, they have the equal rights to it. So that's very true. And we did have a chat just now, and then you say that in Cebu, we had this 800 special needs children getting the dose, correct?
Yeah, today, just this weekend, we just actually have them vaccinated. These are special needs children and also their peers in as I said, in the kindergartens. So
Okay.
all my children here attend the preschool and the kindergarten. So we also not only reject the special needs children, but also we invite their peers, their classmates to come and reject them.
So that's very, very good. So thank you, doctor, and I hope that you will continue to help the special needs children. We need a lot more people like you, and I hope your talk just now will inspire a lot more people to be more committed and help the special needs children, especially the parents. The parents should acknowledge that the children needs to be involved. The parents need to be involved in helping their own children as well.
I think everyone have to be working hand in hand. Healthcare.
Yes.
We are very honored to work with teachers, and of course, we will be. We are grateful for the parents to be involved. I think we all need to work hand in hand.
Yes, very true. Thank you. So after this, we'll go to the question and answer, the live question and answer. So I will ask you questions later on, doctor. Okay. Thank you so much.
Thank you.
Hello, hi. We are back again with Dr. Thor. Thank you for the presentation. And so, Dr. Thor, we have about two questions which I'm going to ask you. Number one, an audience asks, in response to the COVID and the pandemic we have now, we lack infrastructures in schools. So what can the government do to help the special needs students in terms of infrastructure in schools?
Good morning, everyone. It's good to be back to see more live, but still, I prefer to be live as in on the stage and the physical. But anyway, back to the questions. I think in the last 2-3 years, we have seen a lot what we are lacking really. It's not just about education, but also on the health setting, also on the social community level. And I think needless me to say that I think everyone has experienced that in the last 2 years worldwide. And we do know that emphasis on children is still not enough. How much of us is hearing about what do we need to do for the children? We have been hearing what we need to do for COVID. We need more hospital. We need more beds. We need isolation. We need this. We need that. But how much are we hearing about what do we need for the children, other than keeping them away from school, locking them at home? How much of that? I think there are many much. I won't be able to tell the whole long list, but I'm sure there's a lot of discussion going on, and these are the things that I think we need to actually support them. And among those, the couple of things. Number one is I think we do know that our school, some of the schools in the urban area are actually very crowded. So that is definitely not good in terms of COVID, because we know crowd attract virus and cause more infections transmission. Ventilation. Now, most of the schools, well, I should say lucky enough maybe, because it is actually a free air. In fact, we know now free air means good. Aircon means not good in terms of virus transmissions. So I think on that part, we really need to actually look into this to improve the air circulation, improve the ventilation, to reduce the crowdness in the school where the children and the other places that children often meet. For example, toilet. I think we just have to, other than having more toilets, but which is actually something that's quite difficult to do. But certainly, I think we need to actually think about having a different recess time, different toilet time. We do need to actually avoid children being crowded, rush, for 15 minutes, you have to quickly rush to canteen, you have to quickly rush to the toilet, and that create a mixing. I think on that part, we do need to actually think about how to actually improve, make some modifications to actually improve the air ventilation and also the physical distancing. This is just probably, I would say that this is something that we really need to look into it. Among those, this is by all means not the only thing. We have many other things that, if I were to talk, it will probably be another an hour. So maybe Cikgu Daniel had to give me another an hour. Yes, Cikgu.
Yeah, Doctor, thank you for that response. I think in the future, we hope we can have another hour with you. So if the response is good, so maybe our PPD, we can organize something like this again for the coming year. Okay, another question would be, because the special needs students, the special need children, the one we have right now, it's kind of sensitive when it comes to parents. We have parents who are not willing to accept the fact that the children are special needs children. So how can we convince parents to actually get the children to be tested so that they can get the benefits?
Yeah. Well, I think the Chinese, I don't know, some of the, maybe Cikgu, they don't know. The Chinese say, when you clap, you need both hands in order to make the noise. So rather than, quite often of time, I know that some teachers are actually facing some challenge. So does the parent. The parent also facing some challenge. I think that's where I'm saying that we need, being the education professional, as well as the parents, really need to sit down and work together for the benefit of the children. I think that's the very first principle. It is not so much of you parents have to do something, or you teachers have to do something, or worse still, push the problems to the doctors. Doctor have to do something. That's not going to work. I think again for this COVID, I hope everyone has learned that it is not one person job. It is not a government job. It is not the teachers, or it's not a school, but it's everyone. So I think quite often the time, teachers are the one who face the children in the classroom who has problems. And why are the parents not willing, in a sense, why are the parents not willing to accept? I think there are quite a few factors. Number one, as a parent, no one wants to have a child with problem. Everyone dream of having a child that is smart, genius, who can go to university, can have a good life, and so forth. All right, and you can talk to all the pregnant women and father of the pregnant women. They will tell you that, right? But when the child born, when the child growing up, then the realistic thing, the real thing coming. So we do need to give parents some room for them to breathe, for them to grieve. But having said that, also, what can we do? All right, as the doctors, as the teachers, for the parents. Yeah, I can tell the parents that your child has autism, your child IQ is 70, all right. The child also have ADHD. The parent immediately will ask, so how can you help? You as a doctor who tell that my child has this, are you going to help? I think the same question I would like to pose back to the teachers. When we are telling our parents that your child has got problem, so you as a teacher, how are you going to help and support the child? Because quite often the parents' worry is, well, now the teacher said that my child has got problem, and then go to see a doctor, and this doctor will give a label and the child has autism and something. What's next? Quite often the parents are very worried because the child will be kicked out of school, and which I've seen, unfortunately, I've seen many times that the parent will be told that your child is not good for my school anymore. Your child had to go this and that. Your child had to go to PDK, which is absolutely not right. All right, a child of school age need to attend school, not PDK, not to be babysit by some other or NGO. That is not right, because it's education. It is actually Education Act. It is Ministry of Education. It's a law to say that between 7 to 12 years old, we, the Ministry of Education, need to take care of these children in school. So I think on this part, unfortunately we do have on the ground, some certain individual school or certain individual teachers that are actually sending away the children to the parent and leaving the parent with no hope, don't know where to go. Right. And subsequently, and I think it is also important to build up the trust. And I must say that when I first came back in 2004, no one trusts me, no parent trusts me, because who am I? And why should they send the children to me and let me be assessed and give them a label? So I think the trust is very important. And we do know that certain schools have good trust, and certain school that when the guru besar and the teacher say, I think your child has some problem, let's go and get some help. The parent will say, thank you very much, let's do it together. Because they know that they have confidence that when the children get some kind of diagnosis or being assessed, they know that they can come back to the school and the school will support them. And that is very important. And I think, I believe in these 2 days, 3 days of conference, there are many other experts who will share with us how do we actually manage children, how do we actually support children, especially in our school, especially in the mainstream. And some may be supported in PPKI. So I think this is very important. We need to give confidence to the parents. And last but not least, and normally I think the approach is very important. I often share with parents, even myself, I often tell the parents, tell my junior doctors, I think we don't want to be judgmental. And even though a child who walk into my clinic room, by my first glance, I'll say, yeah, this look like typical autism. Even my heart says so. I will not immediately within 1 minute and tell parent, hey, daddy, mommy, I think your child got autism. Now, if I were to say that, no parent will trust me anymore. Because how can I be so judgmental? 1 minute I can say that this child has autism. I think this is not quite right. So how do we approach the child, the parents? I think state the facts. So often in my room, in my clinic room, I spend time, right? And I think on that aspect, teachers have no problem because you have spent hours and hours. So you can share with the parents what you observe. So in my clinic, I will actually spend my time with the parent and tell them what we observe. Based on the assessments, based on the observation, the child has done this 1, 2, 3, 4, 5, 6. So I think the teachers can do the same thing. In the last 3 months, the child has been in my class, and then very often the child will only sit for 3 minutes, and after that the child will start to wake up and go around, and sometimes run outside the classroom. He'll go and disturb other children. So share the facts with the parents, and of course, when we share the facts, we also have to remember their child with strength. And quite often it's good to actually share the strength with the parents first, right? Yeah, thank you very much for coming in today. I would like to share what I have observed about the child in the last 3 months. Inside my classroom, well, the child is very good. Every day he come on time. He never late. Well, praise the parent. And the child are very good. He will sit in my classroom quietly for 3 minutes. And he's otherwise very good. When I ask him to go and help me to go to staff room to get my workbooks, and he always go and respond and quickly. So, however, he only sat for 3 minutes, and after that he will wake up, he'll go and disturb other children. And sometimes he may run out of the classroom without permission, even though I didn't ask him to go to staff room to help me. So if we present the strengths and weaknesses and the facts, rather than just say your child cannot do this, your child cannot do that, and worse still, don't be judgmental. I think your child got autism. I think from the parent point of view, they just cannot accept it. Not only because teachers, you're not qualified as to diagnose, but even as me, as I tell you, even a child walk into my room, very typical, classical looking for autism or classical for any other special need problem, I will not jumping and say, opening my mouth and say, thank you very much for coming. I think your child got autism. I think parent will just run away. So I think on that part, usually we can actually build up the rapport with the parents so that we can actually together support this child. I hope I answered the question.
Yes, Dr. To. And I believe some of the comments have actually shown that they said that the parents they should be involved in it, and they should do something about it along with the teachers in school. So I'm going to show some of the comments here. They said good sharing by Tumina Disun. And then we have Baru Hisham saying very good sharing. And then we have they were also asking if the slide for the presentation would be shared. So are you going to share the slide for the presentation?
Sure, I can send to you, no problem. But I have to take
Okay.
away the pictures of my children.
Yeah, okay.
They
Sure.
don't want to be
So,
famous.
yeah. So we have Rong. Thank you, Doctor, for very good sharing. So I believe very good sharing. So we have about 5 minutes left, Doctor. So I have a question for you, because you're very involved in the Special Olympics. We have the Winter Olympics, we have the normal Olympics. So can you please talk just a little bit about the Special Olympics and how
Okay,
the
sure.
Special Olympics can actually promote our special needs children?
Okay. We have just finished the Winter Olympics 2 nights ago, held in China, Beijing, for those who are watching. And last year, July, we had the Summer Olympics. Cikgu Daniel, I'm sorry to say that there's no such thing as normal Olympics. There's a Winter and Summer Olympics. Okay. Now, after this summer and Winter Olympics, there is this Paralympics coming up. All right. So the Winter Olympics in Beijing is going to follow by Paralympics. So Olympics, as you know, is very competitive. It's actually for the excellent athletes to go and compete. So people like me, just no way that I can go near, because I just cannot compete with anyone. So only the best of the best will get in there to represent their country. So Paralympics is actually for physical as well as intellectual, including those with deafness, including those with with visual impairment, blindness. So again, Paralympics is the best of the best can go in. So we may have athletes that who perform very well in Tokyo Paralympics last year. We may have Paralympics athletes who is going to perform very well this year in Beijing, the Paralympics. However, if next year they don't keep up with their good performance, no country is going to send them. They'll say bye bye. You go and retire. You can do whatever you want. That's why that's Paralympics. But Special Olympics is actually another sports organization. It is a sports organization. It's an international sports organization for people with intellectual disability. So it is actually started in 1960s, whereby we actually the principle is the philosophy is actually about inclusiveness, meaning that everyone, including people with disabilities, can participate in sports. And we are not just looking for good performance. We are looking for sports for life. So even you're 99 years old, so long you can play sport, you can still represent your country, you can still represent your state, your division, your school to participate in these sports. And we play Olympic sports. So we have swimming, we have badminton, we have basketball, we have bocce, we have athletics. And in Sarawak, we have actually every 3-4 years, we actually have a state game. In fact, Sarawak state game for Special Olympics is going to come out this year in June. It's supposed to be 2 years ago, but again, because of COVID, we have to postpone. So we're going to have it in Cebu this year, in sometime in June. So we're going to hear more from the media about this Special Olympics. So this is what a Special Olympics. So we also have a war game. So every 4 years we will go to the summers games, and every 4 years we'll go to winter games for Special Olympics as well. And so how to participate? We have a few chapters. We have one chapter in Miri, we have one chapter in Cebu, we have one chapter in Bintulu, and also in Kuching. So other divisions, definitely you're more than welcome to actually participate. And if you like, contact me or contact any of the Special Olympics that you know, join, right? Get your school to join this Special Olympics so that we can actually celebrate the achievement of the athletes. And these are athletes with intellectual disabilities, and quite often we start the sports as young as 3 years old. So we train the children physical fitness from about 3 years old, and subsequently get them to play a formal sports from 8 years onward until they're very old. So thank you, Jagu.
What's up? So again, Doctor, thank you very much for joining us today. Thank you very much for sharing your insights. And I hope we are going to have a lot more people here in Malaysia, in the world, like you, who's helping our children. And I hope the best for you and for whatever you're doing. So I hope God will bless you and your family. Thank you so much. So that
Yeah, there's a
concludes
question
our
about
slot
how
for
to
today.
join.
And yeah, how to
Sorry,
join.
there's a how to join Special Olympics. If you can actually, my email is at thtorh@yahoo.com. So you can drop the email to me, and then I'll point you to the direct persons for the Special Olympics in Sarawak.
Okay, thank you, Doctor. So have a great day and God bless.
Thank you.
Merakamkan ucapan terima kasih kepada Dr. Toh Teck Hock atas ucap tama sebentar tadi. Sidang hadirin, untuk makluman, sesi pembentangan mengikut 4 sidang selari, iaitu yang pertama, International Special Education, Early Childhood, TESOL and Extra, STEM, Science, Technology, Engineering, Mathematics. Yang ketiga, Language and Arts, dan yang keempat, Other, Management, Disiplin, Counselling and Extra. Para hadirin boleh mengimpas QR Code untuk menyaksikan pembentangan para peserta E-Colloquium menerusi tayangan video yang disenaraikan mengikut 4 bidang selari. Hadirin juga boleh melayari pautan portal rasmi melalui imbasan QR Code yang dipaparkan pada layar skrin untuk mendapatkan info dan butiran senarai peserta, senarai sekolah dan juga penyertaan dari luar negara yang terlibat dalam E-Colloquium Pendidikan Antarabangsa bagi tahun 2022. Rehat seketika sehingga jam 10.45 nanti untuk makluman hadirin. Majlis ini dipancarkan terus secara langsung menerusi laman Facebook dan channel YouTube rasmi PPD Miri. Sementara itu, para peserta boleh mengimbas kehadiran melalui QR Code yang dipaparkan pada layar skrin. Para hadirin juga boleh melayari portal rasmi PPD Miri bagi mendapatkan info dan butiran berkenaan senarai peserta, senarai sekolah dan juga penyertaan dari luar negara yang terlibat dalam E-Colloquium Pendidikan Antarabangsa bagi tahun 2022 melalui imbasan QR Code pada paparan skrin. Majlis mengucapkan terima kasih kepada semua penaja yang telah menyumbang dalam menjayakan E-Colloquium Pendidikan pada tahun ini. Untuk makluman sidang hadirin, majlis perasmian pembukaan akan bersiaran secara langsung pada pukul 2 petang ini yang akan dirasmikan oleh Dr. Pengarah Jabatan Pendidikan Negeri Sarawak bertempat di Imperial Hotel Miri. Jangan lupa untuk bersama menyaksikan siaran secara langsung pada petang ini.
Momen belum hujung bulan lagi tapi korang buka akaun tinggal RM50 je. Apa nak buat RM50 ni? Makan cukup ke? Nak berjuli lagi cukup ke? Sebenarnya paling senang untuk kita elakkan daripada berlaku momen yang macam ni ialah kita asingkan duit kita. Masuk je gaji, kita letak kat satu akaun. Lepas tu kita asingkan untuk expenses satu akaun, untuk simpanan satu akaun, untuk duit runcit satu lagi akaun. Alang-alang kita memang nak manage our money wisely, baiklah kita masukkan duit gaji kita dekat dalam akaun Al-Awfar, yang mana kalau korang masukkan gaji dekat dalam tu, korang juga boleh menang cabutan bertuah jom pindah gaji. Tiap-tiap bulan cabutan bertuah dia grand prize boleh dapat RM50,000. Second prize RM25,000. Third prize RM15,000. Dan paling busuk pun korang boleh menang hadiah sagu hati yang diberikan kepada 10 orang bernilai RM1,000 setiap seorang. Maksudnya tiap-tiap bulan ada 13 orang pemenang, setahun 156 orang pemenang. So korang bayangkan berapa banyak chances yang korang ada untuk menang cabutan bertuah ni. Menarik kan? So nak buka akaun ni simple je. Korang pergi je branch Bank Islam yang terdekat, ataupun sekarang ni semua online. Korang just pergi dekat www.vao.bankislam.com.my. Kat situ korang fill in all the details. Tulis kat situ korang nak buka akaun Al-Awfar. Lepas tu submit. Nanti korang pergi ke branch yang terdekat untuk ambil kad korang. Bila dah buka akaun Al-Awfar, korang pergi dekat HR company korang, cakap je nak tukar akaun gaji daripada bank yang dulu kepada akaun Al-Awfar Bank Islam yang baru ni. Last step yang korang kena buat, korang cuma perlu inform Bank Islam sama ada call 0326900900 atau pergi branch yang terdekat yang korang dah menggunakan akaun Al-Awfar korang ni sebagai akaun gaji. Dari situ, pegawai bank tu boleh register nama dan akaun korang untuk cabutan bertuah jom pindah gaji ni tiap-tiap bulan. Sebenarnya, jom pindah gaji cuma salah satu cabutan bertuah yang ada dalam akaun Al-Awfar. Dalam masa yang sama, korang boleh menang banyak lagi hadiah yang lain. Antaranya, hadiah RM1,000,000, package umrah dan macam-macam lagi. Untuk tahu lebih lanjut, boleh layari www.bankislam.com.
Hadiah apa? Gadget-gadget canggih. Wah. Lagi? Hadiah percutian di tempat menarik. Atau pakej menunaikan umrah. Alhamdulillah. Kau juga boleh menang kereta mewah. Wow. Dan paling gempak, kau boleh menang RM1 juta, bro.
Wow, ini sudah lebih.
Cara senang kan ada.
Tak perlu pening lagi. Layari laman web Bank Islam sekarang. Lebih cepat, lebih jimat.
Rasanya dah tiba masa untuk saya beli kereta. Tapi nak beli kereta yang mana ya? Yang ini atau yang ini? Saya juga kena tahu kelayakan, berapa jumlah pembiayaan, kadar keuntungan, bayaran bulanan. Kejap. Saya ni baru je dapat kerja. Slip gaji pun tak ada lagi. Boleh ke mohon pembiayaan kenderaan? Nasib baik terjumpa pelan pembiayaan kenderaan I Bank Islam. Melalui program Grad Hits, lepasan ijazah seperti saya pun boleh dapatkan pembiayaan. Tak perlu slip gaji pun kalau kerja kurang dari 1 bulan. Hanya perlu surat tawaran pekerjaan serta salinan scroll atau transkrip. Yang menariknya, saya boleh dapat pembiayaan sehingga 100% daripada harga kereta. Bestnya! Tahu tak, selain kenderaan nasional, Bank Islam juga ada pembiayaan untuk kenderaan bukan nasional dan unregistered recondition. Biasanya orang panggil kereta recon. Pembiayaan pastinya patuh syariah dan kadar yang ditawarkan pun kompetitif. Kalau berlaku benda yang tak diingini ke atas saya, macam mana? Jangan risau, terdapat juga pilihan pelan perlindungan takaful atas semua pembiayaan yang berbaki. Wah, patutlah ramai yang pilih Bank Islam. Nak lebih info lagi, layari easyaccess.bankislam.com.my dan masukkan maklumat anda. Bank Islam akan hubungi anda semula atau imbas kod QR ini dan layari www.bankislam.com. Saya tak perlu risau jika kekurangan tunai dalam dompet. Lebih mudah dan pantas bila guna kad debit AIB untuk berbelanja di mana je. Kad debit ini ringkas. Bila saya menggunakannya, jumlah yang saya bayar akan ditolak terus daripada baki dalam akaun simpanan. Tapi pernah juga bila nak bayar, duit dalam akaun pula tak cukup. Nasib baiklah saya ada kad kredit I Bank Islam. Dengan kad kredit I Bank Islam, saya terus boleh membuat apa-apa perbelanjaan. Penggunaan kad akan ditolak dari jumlah pembiayaan. Setiap bulan, saya akan terima penyata kad kredit I. Saya hanya perlu semak transaksi yang disenaraikan dan bayar baki penyata sebelum atau pada tarikh matang. kenapa saya pilih kad kredit iBank Islam? Sebab tiada charge keuntungan berganda. Dan jika bayar penuh baki penyata, saya takkan dikenakan charge keuntungan langsung. Kalau saya membuat pembayaran minimum atau kurang daripada penyata kad bulanan, charge keuntungan hanya dikira berdasarkan amount prinsipal yang telah digunakan. Yuran tahunan juga akan dikecualikan bila guna kad kredit I minimum 12 kali dalam setahun. Dengan True Rewards, saya dapat mata ganjaran True Points apabila berbelanja dan saya boleh tebus pelbagai barangan dan voucher yang ditawarkan. Apabila buat pembelian runcit RM1,000 ke atas, saya boleh melanggan pelan ansuran transaksi runcit RSVP yang mana saya boleh memanjangkan tempoh bayaran ansuran pada 6 bulan ke, 9 bulan ke dan lebih lagi. Ada banyak lagi kemudahan kad kredit iBank Islam ni. Pengeluaran tunai, pindahan baki dan pelan pelindungan takaful percuma. Menarik kan? Nak tahu lebih lagi? Layari easyaccess.bankislam.com.my dan masukkan maklumat. Pegawai Bank Islam akan hubungi anda semula. Atau imbas kod QR ini dan layari bankislam.com. Anda berminat memiliki rumah? Apabila dah beberapa tahun bekerja, saya pun bercita-cita nak ada rumah sendiri. Selain memikirkan jenis rumah, lokasi dan harga, saya juga runsing memilih bank yang menawarkan pembiayaan yang sesuai. Yalah, saya nakkan margin pembiayaan tinggi, kadar pun okey dan yang paling penting, patuh syariah. Nasib baik saya jumpa pelan pembiayaan rumah by TI Bank Islam. Bank Islam menawarkan pembiayaan pada kadar kompetitif dan pastinya patuh syariah. Saya juga boleh dapat pembiayaan sehingga 100% melalui skim rumah pertamaku. Syoknya! Lagipun, sebagai kaki tangan kerajaan, saya boleh memohon pembiayaan bersama pasangan melalui skim Bank Islam LPPSA untuk memiliki rumah idaman yang lebih mahal. Hanya bawa surat tawaran daripada LPPSA ke cawangan Bank Islam. Senang kan? Selain itu, ada juga pelan pembiayaan semula rumah Wahdah I. Pelan ini sesuai untuk anda yang ingin dapatkan lebihan tunai dengan membiayai semula rumah mengikut harga pasaran semasa. Dengan duit lebih ni, anda boleh buat pelbagai rancangan kewangan seperti penyelesaian hutang, pelan persaraan, kos pendidikan atau perubatan, mengubah suai rumah dan lain-lain lagi. Terpulanglah pada anda. Sudah tentu, banyak kelebihan dengan pembiayaan rumah Bank Islam. Margin pembiayaan menarik, tempoh pembiayaan panjang selama 35 tahun atau sehingga umur 70 tahun, tiada lock-in period, tiada penalti untuk penyelesaian awal, tiada yuran pemprosesan, tiada elemen compounding, tiada charge tersembunyi. Nak tahu lebih lagi? Layari easyaccess.bankislam.com.my dan masukkan maklumat. Pegawai Bank Islam akan hubungi anda semula. Atau imbas kod QR ini dan layari bankislam.com. Pernah tak anda buat kesilapan dalam merancang kewangan? Saya pun sama. Semakin banyak duit, semakin banyaklah komitmen beranak-anak. Macam bayaran kos pendidikan, pinjaman koperasi atau hutang-hutang lain dengan kadar keuntungan yang tinggi. Setiap komitmen ini kadarnya berbeza-beza. Setiap bulan kena bayar satu-satu. Leceh tak? Jangan risau. Gabungkan semuanya dalam pelan pembiayaan peribadi I Bank Islam. Melalui pelan ini, anda boleh satukan semua komitmen tadi pada kadar kompetitif. Kadar yang dikenakan pun jadi satu dan nak buat pembayaran pun senang. Pastinya lebih jimat, lebih mudah. Dengan pembiayaan peribadi iBank Islam, anda boleh mohon amount pembiayaan sehingga RM300,000 dan tempoh pembiayaan sehingga 10 tahun. Pandai-pandailah rancang ikut bajet sendiri. Yang menariknya, ada pilihan pelindungan takaful atas baki pembiayaan dan anda tak perlukan garantor. Bukan itu saja, anda juga boleh sertai macam-macam kempen yang diadakan untuk pelanggan Bank Islam. Wah, banyaknya hadiah. Jadi, rancanglah kewangan anda dengan bijak bermula hari ini. Ingat, apabila gagal merancang, kita merancang untuk gagal. Nak tahu lebih lagi? Layari easyaccess.bankislam.com.my dan masukkan maklumat. Pegawai Bank Islam akan hubungi anda semula. Atau imbas kod QR ini dan layari bankislam.com.
Many parents worry financially to fund their children higher education, and students uncertain about the program that will give them the future. Worry no more. At KLT we offer up to 100% scholarship and the
sekalian, bersua kembali dengan sesi pembentangan bersambung mengikut 4 sidang selari. Yang pertama, International Special Education, Early Childhood, TESOL and Extra. Diikuti yang kedua, STEM, Science, Technology, Engineering and Mathematics. Yang ketiga, Language and Arts. Dan yang keempat, Other, Management, Discipline, Counselling and Extra. kita beralih kepada sesi plenary 1, Associate Professor Dr. Aznan Ahmad, Raising Your Child with Special Needs, Guidance and Practices. Untuk itu, majlis mempersilakan moderator kita untuk mengupas sidang selari 1 International Special Education. Dipersilakan.
Thank you to our MC. Assalamualaikum and very good morning. Honorable Associate Professor Dr. Aznan Ahmad, distinguished guests, ladies and gentlemen. First of all, I would like to welcome you all to this International Education E-Colloquium year 2022. In this session, we would like to have a presentation from Associate Professor Dr. Aznan Ahmad. Ladies and gentlemen, allow us to introduce our speaker for today. Dr. Aznan Ahmad is a special education lecturer at the School of Educational Studies, Science University of Malaysia, USM. He completed his certificate of teaching at Sultan Abdul Halim Teacher Training College, majoring in preschool. Soon, he obtained a certificate in teaching deaf students from Maktab Perguruan Ilmu Khas and diploma in teaching and teaching the blind from Maktab Perguruan Ilmu Khas. He majored in special education for both his bachelor's and master's degree from National University of Malaysia, UKM, and later a PhD also in special education from University of Melbourne, Australia. Ladies and gentlemen, without further ado, we would like to welcome Associate Professor Dr. Aznan Ahmad to deliver his presentation entitled Raising Your Child with Special Needs, Guidance and Practices. All right, doctors, the floor is yours.
Okay, thank you, Cikgu Kamel, Mr. Moderator. I would like to welcome all participants of the International Education E-Colloquium 2022. Okay, I would like to share. Well, first of all, before that, I would like to congratulate the PPD, District Education District Office of Miri, Sarawak, Malaysia, for organizing this E-Colloquium. Okay, my talk will be on raising your child with special needs, guidance and practices. I would like to share a few tips and share a few techniques or strategies that parents who have the children with special needs can practice at home or can practice with their child. Okay, as a parent, our role is ever changing, where every day is a new day with a new set of challenges. And this issue also goes for all special education teachers in Malaysia and in the whole world. Why? Because our special child or our student with special needs, they will show or they will perform a different behavior every day. Sometimes that is why I said ever-changing challenges. Because sometimes if you try a strategy A today, but the same strategy will not success tomorrow. Why? Because this the special about our children with special needs. Therefore, as a parents of special needs children and teachers who are teaching the special needs children, you are actually an expert in handling the children with special needs. Okay, when we are talking about the challenges, What are the challenges normally faced by the parents and also by the teachers? Because for the teachers, we treat the students with special needs as our own children, because we know we are the only one who can help the children with special needs. For example, the challenges that faced by the parents are normally also faced by the special education teachers. The first issues are the health issues. As parents, normally we are worried about our children's health issues. Why? Because we don't have enough information, we don't have enough exposure, and we don't have enough knowledge about our children's health. For example, my experience, there are some cases where late identification, in which the parents, they take time to detect that their child is having a special education, a special needs problem due to the health issues shown by the child. For example, hearing loss, or autism, or ADHD, or speech delay, or developmental delay. Why? Because it's our belief that maybe our parents will tell us it's okay. You yourself also, you start walking when you are 24 months. So it's normal for your child. But when looking back to the normal developmental chart, you will notice that your child is having delay in some part of the milestone. Therefore, as a parent, you need to be aware of your child's developmental milestone. Sorry, I have to drink. Sorry if I keep on coughing or what, because I am just cured from COVID. Last week I take off my pink bengal, so it keep on irritating my throat. So be patient with me. Okay, as a parent, I would like to strongly suggest and strongly ask the parents outside there to know about our child's developmental milestone. At this certain age, what our child should be able to do. He or she should be able to crawl. He or she should be able to learn to step. First step, second step, and so forth. Why? Because if this delay is normal, then it's okay. But if this delay is related to some issues of special needs, then you need to have an early identification so that your child will be having a early diagnostic, and therefore your child will be having an early intervention in which this will help your child for their further developmental. Okay, for example, there are cases that the child only know, the parents only know that the child is having autism at the age of 20 years old, when the child is furthering his studies at one of the higher educational studies in vocational. So when the child is having problem, the lecturers call the parents and inform the parents that your child cannot cope with this module. Why? Because these are the hint, or these are what happening in the class. So after looking for the case, so I advise the parent to go and have a medical appointment. So referring to the general hospital, then the GP sent for a further checkup. having a blood test, having a psychology test, and the child is confirmed to have a mild autism at the age of 20 years old. These are very late. But if this identification happened earlier, I strongly believe that the child will be more success in his education. The child is okay. He is having STPM qualification. Okay, these are about health issues. Then about behavior issues. The second challenge is behavior issues. Most of our children with special needs, they are having a behavior issues. Why? Because they don't know what is right and what is wrong. They don't know how to behave in certain situation. They don't know. Why? We cannot blame the child. We cannot say it's 100% the child's problem or the child's fault. Sometimes we need to see ourselves. Why? Because there are some parents that don't want to expose their child to the life outside there. So therefore, the child did not expose to a good behavior. For example, if they go to your friend's house or your sibling's house or your parents' house, what is the do and don't? What that they can do and they cannot do? These are the one issue. Then how you discipline your child at home, because there are cases that at home you can do whatever you want. The child don't care, but the child, the parents don't really have a strict discipline. You can mess up your toys. You can do whatever you want. You can climb up the sofa. You can jump here. You can jump over there, as long as you don't disturb the parents. And this behavior will prolong and will also happen in other space, in other places, in shopping complex, at your friend's house. But if you have a good discipline issues at home, if you have a good behavior control at home, then your child know how to behave when he or she is outside your house. For example, shopping complex. We can see that this happen even to normal kids, normal children. When the child needs something, the child will show his or her tempered, stepping on the floor, crying, sitting down on the floor, crying. Then the parents buy, or the parents give whatever the child wants. This will develop a negative behavior. The child know if he or she behave like this, then the parent will fulfill whatever he want or she want. For example, like undress. There are some special kids that they don't want to wear dress at home. And you say, okay, as long as he behave well. No, it's wrong. What is wrong is wrong. We cannot say that it's okay because it is a special kids. No, you are wrong. Then developmental issues, same goes with the developmental milestone of the normal kids. You should know the learning issues. How you can help your child to learn in school or in the PDK or in any centers. As a parent, these are very challenging for us because we don't have the pedagogical knowledge. We don't have the pedagogical exposure on how to help our child to learn. Then mental health issues. These mental health issues is for us as the parent. If you cannot handle your child well, if you are so stressful, then you will have a mental health issues that will bring a negative effect to yourself and as well to your child. Then the independent issues of your child. How you will help your child to be independent. These are the things that worry you. And the final one is the future life. How will my child live after I will not be in the world anymore? These are the things that really worried parents with special needs. Okay, parents, remember that in searching for ways to help our children, we are actually looking for ways to help them to help themselves. These are very important. We are actually looking for the ways to help them to help themselves. Our job as a parent is not to cure them, but we are trying to give them as much as possible the social and emotional tools that they need to be independent, that they need to survive in the real world. Because if we trying to cure them, we will be frustrated with our intention, because we cannot cure our children with special needs, but we can help them to minimize their obstacles. We can help them to success in life. How? Through giving them a maximum exposure in social and emotional in the real life. In the long run, the way how we face and overcome the challenges will help our child to grow stronger and be more resilient. Why? Because the way how we behave, how we respond to the challenges will have or will bring a big impact to our child. Because if you give up earlier, if you give up when you're trying something that will not success, then your child will know it's not good for the child. Okay, now is the emotions of parents with special needs. Emotion of parents with a child who has special needs. Okay, the emotions of parents with a child with special needs are different from our counterparts, are different from the parents who do not have a child with special needs. Is different from the child who don't need a special care and attention, because the special care and attention that need by our children with special need is really, really special. That sometimes you might give up, or sometimes you feel restless, or sometimes you feel frustration because you don't know how to take care of them. You don't know how to give attention to them. You know how to deal with them, even though they are your child. And sometimes our emotion as a parent who is having a special need child, we might feel a profound sense of helplessness. We might have a strong sense of grief, and even a strong sense of loss of hope due to how we perceive the future of our child. Don't put a high expectation to our child with special needs, even though we would like to see our child to success in their life. But bear in mind, there are certain obstacles that we need to overcome before our child will face the successful in their life. Okay, parents, remember that there is no one as interested in and motivated to see our child succeed compared to ourselves as the parents. So, we are the right person that can provide information on our child. What are the information? The information are the strength and weaknesses. We parents are the right person who know the strength and the weaknesses, and we need to use the strength of our child to overcome their weaknesses. Not only see their weaknesses, but use their strength to overcome their weaknesses. And we are the correct person who have a vast information on the child's history and development. We know. And we are the correct person who have the information on our family factor. And the last one is we are the one who have the full information about what may affect the child's learning process, and use this information to collaborate with the teachers. Use the information to collaborate with the interventionists. Use the information to collaborate with the OTs and whoever professionals are dealing in helping our child. Do not keep it to yourself. Go forward. Go to the front and share with the practitioners. Parents, we should be prepared to offer feedback. So when we send our child to OT or when we send our child to an interventionist, give them feedback. What happened at home? Is there any positive feedback or negative feedback? Share with them. Because sometimes their strategies might not help our child. Because as I said before, when dealing with special needs, there is no such thing as one fit all. Maybe strategy A might work for Ali, but might not work for Achong. These are the things that you should share with the professionals that are helping your child. And provide them suggestions on how to help your child. Because you have the knowledge, but they have the skills. So, through the combination of knowledge and skills, you can improve the way how to help your child. Next one is learn more about your child's need. As a parent, you need to do a research. You need to do a reading more about your child. For example, if your child diagnosed with autism, ASD, so do reading on ASD. What are the criteria of ASD? What are the behavior shown by ASD? What are the play pattern? What are the thing that the ASD child cannot do or can do? Or what are the things that we irritate the child with ADHD? These are the thing that you need to know. Don't rely on the information given by your medical doctor or by your professionals that are helping your child. You need to do your own reading. By knowing the specific needs of your child, we make things better care of. If you don't learn, you will focus more on what your child cannot do because you don't have exposure about the successful of ASD child. You don't read about how parents can overcome this certain behavior, how parents deal with this certain behavior, how this thing can be solved, or how this thing can be helped when it happened to your child. So you need to do your own reading. That is my conclusion. Be positive, not always be negative. Why? Because just because your child has a specific way of doing things, it doesn't make him or her unfit. You must think in that way. He or she can do that activity, but in different way. He or she can help you in the kitchen, but in different way compared to his sibling. He or she can explore the environment. He or she can do the activity, can play, but in different way. So these are the things that you need to identify and need to help your child to be as normal as they can. Normal means not as normal kids, but normal as they can do. They can run. The normal kid also can run, but they can run within their capability. They can run within their ability. They do things differently. This you might notice. They can wash their own plates, but differently. You need to guide them how to clean their hand, how to clean their own clothes, how to take a proper shower. There are issues that the child is big enough, 18 years old, but the parents still give birth to them. This is not right. They are already big. Okay, let them have their own shower. Teach them how to have a correct way of shower. Having a special need children doesn't mean that being successful in our life. We have to be mentally and emotionally strong for the sake of success of our child. Help with homework. So when your child go to school or any NGO centers, they will have homework, exercise. So set a specific time to be with your child, to help them in their homework, guide them, communicate with them because they need some assistance. Spend time with them, not be with them, but you are watching television and while at the same time they are doing their homework. This is not right. Be 100% with them. Spend 100% with them. And if possible, choose a specific time. For example, 8 a.m. or 8 p.m. every day is a homework time. If there is no homework, you provide your own work, your own exercise to them. Maybe homework or any exercise on addition, subtraction, or whatever activity that do with your child. Meaning that have a specific routine. Ask question and be patient while they are figuring out the answer. We have to bear in mind that when you ask them some question, they are triggering what are the words to use to answer us. Sometimes they know the answer, but they couldn't find the correct word how to answer us. And don't forget to praise them, because praising do not need to use any money. Good boy, good job, you make me proud. Oh, good, thumbs up, give me 5. This will give them more confidence and will motivate them to give more correct answer. Help our child to be self-confident. Don't let them think that they cannot do something else. Let them think that they can do something, but in different way. Set a small day-to-day goals. Every day set a goal. Okay, today maybe you can do addition 2 plus 2, or maybe today you can fold your own shirt, or today maybe you can tie your own shoelace. Set a small day-to-day goals, not a big goal. Just a small goal depends on your child. Focus on the big picture. We should worry about our child's future. Why? Because they will live after we left the world. Who will taking care of them? So plan for their future. Help them to be independent. Set up discipline. These are very important. Don't ever put discipline aside just because our child is a special need child. Don't ever think of that. We have to teach our child that they need to understand and respect other people and respect the rules. They have to line up. They cannot take people's toys or their friends' toy and bring home. They cannot simply touch other people's body. And setting up discipline is you need to keep on teaching them the do and don't. Always. Positive reinforcement. Build a strong sense of self-worth, confidence, and the determination to keep going even though things are tough in ourselves as a parent. Because we have to bear in mind that life have to go on. Become your own expert in helping your own child. There is no one else that will help your child as what you willing to do. Be an advocate for our child. Even though there are sometimes that our activities or our plan might make us frustrated, but we need to remain calm and be reasonable. Why? Because whatever we do will make a huge difference to our child's future. Focus on our child's strengths and not weaknesses. Because we have to remember that our child is not defined by their learning disability. Learning disability only represent an area of weaknesses or area of weakness, but there are other areas of strengths that our child have and they can do. Focus on this. You can pinpoint the specific challenges your child faces and find a intervention program that works. So find their weaknesses and try to help them how to overcome their weaknesses. Understanding the different type of learning disorder and their sign. Keep the lines of communication open with our spouse, our family members, our friends, with their siblings, with their brother and their sisters. Explain to them, your brother is having this symptom. So these are the things that he or she cannot tolerate with. So as a sibling, you need to respect your special needs sibling. And as for the special needs child, he or she also need to respect his siblings' right. These are the two ways of understanding that we might or we have to develop the discipline in our house. Build a healthy life. Develop a healthy lifestyle that best suit our child. For example, eating healthy food, doing exercise, sleeping on time. Expose our child to outside world. Bring our child outside to the shopping complex, to the playground. Have a healthy meal. There are cases that the child don't have enough sleep. Why? They keep on playing with the gadget. So how to help them to have enough sleep? The first one is try to have a warm bath. Not hot water, but a warm water. Because a warm bath will help our child to relax and get ready to sleep. Next tip is keep the lights dim. Why? Because our child body will produce the sleep hormone when the light is not too bright. Because sometimes our child, they cannot sleep. It's totally dark. So they need a bit of light. So make sure that the light is dim, as dimmer as possible. Then once they are in bed, encourage our child to read quietly or listen to some relaxing music. Or you can have a storytelling with your child. And this will help them to calm and sleep. Avoid large meal or caffeine before bedtime. You know best for your child. What drink make your child active? For example, if you're having an ADHD child, avoid giving sugar at least 2 hours before bedtime. Or avoid them to have an active activity before 2 hours before time. Help your child to be active during daytime. Bring them to playground and do some active activity. Why? Because by doing active activity during the day, it will help them to fall asleep at night. And model good sleep behavior for kids. Don't ask your kid to go to bed and yet you are watching TV with the loud volume. They know that you are still outside there watching movie. You are still outside there watching something. And this will make them not ready to go to sleep. Okay, these are the we as parents, we should know that what are the approximate hours of sleep need by our child. For example, babies 4 to 12 months old, they need 12 to 16 hours including nap. Toddler 1 to 2 years old, they need 11 to 14 hours including nap. Children 3 to 5 years old, they need 10 to 13 hours including nap. Children 6 to 12 need 9 to 12 hours. Teenagers 13 to 18 need 8 to 10 hours, and make sure that our child have enough sleep. Avoid screen in the bedroom because avoid them to bring their phone to bed. Avoid them have charging facilities in their bed because this will make them not ready to go to sleep because they might stay up late, even wake up in the middle of the night to use social media or to play games. They might sleep, but at 12 midnight or 1 a.m. they will wake up and use the gadget to play games. Okay, these are the symptoms. Normally, if a child get poor sleep, for example, headache, problem in concentrating and staying awake in school, so this is not good for them to learn. Then they will be more hyperactive, poor academic performance, and difficult to wake up in the morning to go to school. And parents, we also have to bear in mind that we need to take care of ourselves because if you are not healthy, if you are not okay, then who will take care of your child? Don't burn yourself out. Be emotionally and mentally fit. Why? Because our child depends on ourselves. Our child depends on us. And try to join parent support group so that you know that there are someone else outside there are having the same problem as you. You can share the problem, your problem, and you can know and you can exchange the experience on how to help children with special needs. Okay, for example, how you can advocate your child in learning aspect. Correspond with teachers and other profession. Do not set a barrier between you and the teachers or the professionals. Ask them what you can help at home. Learn as much as possible about your child disability through the teachers and through other professionals, other than through your own reading. Observe your child's learning style. This is important. We have to know our child's learning style. Why? Because through learning style, this will help our child to be more ready, more focused in their learning process. Okay, visual learners. Visual learners are children who learn best by seeing or reading. They will do better if their reading material is presented or they are tested visually rather than verbally. They prefer to read rather than to give a verbal instruction. They benefit from written notes, direction, diagram. They love looking charts. They love pictorial. Normally, children with special needs, they love pictorial books rather than books that have a lot of words. And these visual learners, they may love to draw, to read, to write, and they are often good in spelling. They are good in numbers. Then the other one is auditory learners. They learn best by listening. They can do something else, but at the same time, they are listening to what the teacher is teaching. When they are being asked some question, they can answer even though they are working in the class, even though they are not paying attention to you, and yet they can give you a correct answers. Why? Because they are auditory learners. Kinesthetic learners, they learn by doing and moving. These type of kids, they like to explore. They like to touch, they like to explore, they like to create in order to learn. Normally, this type of children, they benefit from hands-on activity. Behavior modification. These are the techniques that we parents can use to help modify our kids' behavior. The first one is positive punishment. Positive punishment means that involve adding a consequence that will deter your child from repeating the behavior. And this positive punishment can stop negative behavior. Example is involving adding a consequence that will deter the child from repeating the behavior. Means that this positive punishment will help the child to repeat the same behavior. Example, give extra tasks for not doing something. For example, like if he or she do not wash his own plates, he will have to wash your plate as well, and you will be standing next to him. Or if he do not clean his room, he need to do an extra task, or write an apology letter, or help their sibling in completing their sibling task. Means have additional activity as a punishment. Negative punishment, time out, taking away gadget. Time out, maybe for example, like when doing some activity, he or she cannot take part in the activity. Positive reinforcement. Example, praise, reward system or token economy. These are the example of token economy that you can have at home. Whenever your child use gentle touches of using kind words, these are the activity that you will target. As what I mentioned before, is the small objective or small targeted activity each day. So whenever your child use a gentle touch, you will make a mark. So when complete the whatever numbers or amount of activities that you already have an agreement with your child, you will reward him. For example, you will reward him with 1 hour of playing games, or you will reward him with some good meals, but through the agreement with your child. These are another example of token economy. A chosen reinforcer of, so what are the intention? I'm working for maybe a toy here or activity, for example, swimming. So whenever your child accomplish 12 STEM or 12 whatever positive behavior that you agree with him, you will bring him for a swimming activity, for example. These are another example of behavior modification. So whenever he or she show a good behavior that already agreed between you and your child, you giving a star. So when completing the star, he will be given whatever activity or whatever thing that you agreed with him or her. So I'm working for this. So I need 5. So good job, good job, good job. This one you can put back. For example, he already have 4 good job, but he repeat to do the negative behavior. So you can pull out. So he only have 3. So this thing based on your own creativity, on how you manage or you agree with your child. Negative reinforcement. For example, like you will do something that your child will not happy with it. For example, like if your child keep on fighting in classroom, argue in classroom with the child, with his friend. So you discuss with the teacher, you ask permission, you may standing outside the class. So he or she might feel ashamed that his parent or her parent is outside there. So he will not do the same thing. Or if the child likes to split, ask him to split until he feel tired to do the activity again. These are some of the other routine chart that you can do at home. Ask him to do the activity as agreed, and this is to help them to discipline. Wake up in the morning, feed, water dog, make bed, brush hair, get dressed. These are another example that you can have at home. So these are the things that I can share with you on how you as a parent, we as a parent can help our child to have a better behavior, to have a better discipline. So this might not work, but it's just a guideline or guidance for you, because as I mentioned before, whatever activity works for another children might not work for our child. So in dealing with our children with special needs, we have to be more on some sort like try and error. Whatever works for our child, we can share with other parents. For example, when this thing happen, these are what I tried to do with my child, and this works. So my last point is, so when dealing with our children with special need, in raising them, we do have a lot of obstacles, and take these obstacles as a challenges for us. Don't set a high target for our child's success. Be happy with their success, even though it's a small success, but it's big for our child. With that, I thank you. Back to you, Mr. Moderator, Cikgu Kamel.
All right. Thank you, Dr. Aznan. Thank you for the informative and interesting talk. So now let's move to the next sessions that will be our question and answer session. Okay. So let me start with the first question, Doctor.
Okay.
Okay, Doctor. What is the long-term consequences if we ignore the issues that are currently happen in raising child with special needs? I repeat, what is the long-term consequences if we ignore the issues that are currently happen in raising child with special needs?
Okay. The long-term consequences if we ignore our children with special needs, the raising, the issue is, the main thing is our child will be is what they are now. That's why I strongly suggest parents, please don't ignore changes in our child. We need to work to change our child, because sometimes as what I mentioned earlier, for us it's okay. Okay, I just share one more example. In USM we have our own PDK, pemulihan dalam community. Okay, so another cases is, there is a child 14 years old. So the parent told me, Prof, they said, Doctor, my child don't want to wear his pants and clothes at home. He like to be naked. 14 years old. He don't feel ashamed with his siblings and parents. Whose fault is that? Is the child fault? No. What happened 14 years? Why the parents ignore this behavior? What the parents have done to make sure that the child is wearing the clothes and the pants? And the child know, the boy know that he need to wear the clothes and the pants when he is outside the house. This shows that he know that he need to wear the clothes and the pants. But maybe for the parents, it's okay, because my child is having a special needs. These are the one example of long-term consequence in behavior. And the thing is, social behavior. If you don't expose your child to social behavior, your child is not only staying at home. He is going outside. He need to go outside to work. He need to go outside to buy things. He need to go outside to have social life. He need to go outside to the shopping complex. He need to know how to behave in shopping complex. He need to know how to queue up, how to use money, how to wait for the change to be given to him. If you don't discipline your child, you don't expose them to these all skills, so the long-term consequence is your child will be depending on you always, and this is not for not this is not good for him, and it's not good for you as well. So in long term, there is a lot of negative impact if you ignore to over to I mean to help your child in overcoming their issues.
Yeah. Okay, Doctor. Actually, we have a lot of comments from our viewers here.
Okay.
Okay. Good sharing. Thank you for sharing, Doctor. And then great sharing from our speaker. And then I would like to highlight this one, Doctor. Good sharing, but both my children has difficulty sleeping even though they are tired of playing during the day.
Okay.
You go to this. So what do you
Okay.
think of
Thank
this,
you. Thank you.
Doctor? It's quite
Okay.
interesting, this one.
Yeah. Because I cannot directly answer this because I don't know what because sleeping issues doesn't only rely on the playing during the day. It also
Yeah.
rely on the meal that you give to your child. For example, if your child is having ADHD, you should avoid all the sweet drinks, sweet food. For example, cannot drink any sweet drink, hot drinks or whatever. No chocolate, no fizzy drinks. At least 2 or 3 hours, because this is a try and error. Some ADHD, they need not to drink a sweet drink 2 hours. Some kids 3 hours. Depends on the child, because
Okay.
by playing only, it won't help your child to sleep early. You need to know your child. Maybe
Oh,
sometime they are trying to sleep, but you are watching
yeah.
TV. Their siblings is playing outside. Is the sibling is laughing outside. These are the things that might
Okay.
stopping them from sleep early.
Okay. So,
Okay.
Doctor, maybe one last question for you. Do we have special school for these gifted children? Do we have special school for these gifted children?
Okay. Thank you for
Last
that
question
question.
before we end our
Yeah.
session.
Okay, UKM, they are having the Permata Kunia, Permata Pintar. These are for the gifted students, and
Okay.
yeah, they are having that. And before that, we are having Pelayan Darjah 3 last time.
Oh, okay.
But we don't have a specific school for that over throughout Malaysia. But in overseas, they do. In overseas, they call it like acceleration program.
Oh, I
From
see.
Form 1, you can skip to Form 3.
Oh, I see.
Yep. And they have a certain criteria on how this happen.
Hmm.
So if you have a gifted and talented students, make sure you don't expose them too much, because if you expose them too much, you might bring them to a bored feeling. For example, like they don't want to go to school because they're saying, the teacher is teaching me addition 3 plus 5. I can do 13 plus 26 already. So this
Yeah.
will make them feel that they don't want to go to school. So
Hmm.
you might to be really creative and really careful when tackling
Yeah.
about your gifted
Hmm.
talented students,
Yeah.
because
Like
the
you
teacher
said.
might not understand your child.
Yeah, that's correct. Yeah, it's just like what you said in your talk just now. We need to focus on their strength also, not only merely
Yeah.
focus on their weaknesses. All right, doctor. I think that's a quite interesting topic for us for today. But the time is quite jealous to us, so we have to end this session, doctor. Maybe
Okay.
one last word from you, doctor.
Okay. My last word from me is, whatever category of children with special need you have, spend time to know your child, and
Okay.
don't ever think of, oh, my child is having special needs. It's okay that he or she behave something that is not correct. No, don't use that excuse. Even though they are children with special needs, they need to behave as normal people. Bear in mind of that.
All right, quite interesting. Okay, so we need to treat them like the normal children as well, huh?
Yeah.
Okay, doctor. So that's all. So thank you for your sharing for today, and we really appreciate your contribution towards this our colloquium. Okay, so we hope to see you again in the future for this quite strategic collaboration. Okay, so that's all. So ladies and
Thank you so much,
gentlemen,
Doctor.
finally we have come to the end part of our presentation. We would like to say thanks again to our speaker, Dr. Aznan J. Ahmad, for the informative and interesting talk, and to the audience also for your active participation. Hopefully, the presentation will be beneficial for everyone. All right, thank you for your attention and good day, everyone. Assalamualaikum warahmatullahi wabarakatuh. Thank you.
Majlis mengucapkan terima kasih kepada moderator dan Asosiat Profesor Dr. Aznan C. Ahmad atas sesi plenary 1 sebentar tadi. Hadirin sekalian, kita akan berehat seketika untuk makluman majlis ini dipancarkan terus secara langsung menerusi laman Facebook dan channel rasmi YouTube PPD Miri. Para peserta boleh mengimbas kehadiran melalui QR Code yang dipaparkan pada layar skrin. Majlis mengucapkan terima kasih kepada semua penaja yang telah menyumbang dalam menjayakan E-Colloquium pendidikan pada tahun ini. Untuk makluman hadirin, majlis perasmian pembukaan akan bersiaran secara langsung pada pukul 2 petang ini yang akan dirasmikan oleh Dr. Pengarah Jabatan Pendidikan Negeri Sarawak bertempat di Imperial Hotel Miri. Jangan lupa sertai kami secara langsung pada petang ini.